Now then, about 7 out of 10 people who are taken to hospital with COVID-19 have not fully recovered after 5 months, according to recently published research. Now, there are many more who are not admitted to hospital, but also suffer symptoms of long COVID, such as muscle pain, fatigue, breathlessness or brain fog for a considerable time. Well, I'm joined now by the actor Emma Sams, who is suffering from long COVID. Very good to talk to you, Emma Sams. Now tell us, Emma, I understand you contracted COVID, you think, almost exactly a year ago on the way back from America. Did you end up in hospital?
I didn't. I was sent to hospital, but I wasn't admitted, which was obviously fantastic. But I had to sort of do as best as I could at home after that. And I was, as one would imagine, anticipating that I would feel better very soon, and was just, sort of willing myself to get through the 2 weeks, we thought. And then actually I just never got better.
Did you have a respite or anything like that and it came back, or have you just been feeling terrible for these 12 months?
Well, it isn't linear. It does go up and down, and you have good days and bad days. And that confuses people around you, and it confuses me too sometimes. So the trick is not to push yourself too hard on the good days, because you think, oh, finally I can do, like I bought a bike ages ago and dying to get out on it. And I've stopped myself because you just pay the consequences all the more the next day. So it's very odd psychologically.
And what are the symptoms? I mean, you described the tiredness there, well, the exhaustion, I should say. What else?
Well, for me, and everybody has different symptoms, which is making it very tricky for the doctors, of course. But for me, it's, as you can hear, it's shortness of breath. I have chest pain and the amazing fatigue that I've never known anything like that before. Even when I had 2 little babies up at night, nothing even close to that. So it's also, I've got the sort of standard not being able to smell much at all or taste anything. Sometimes I have some weird phantom smells, like I keep smelling diesel fumes at the moment. That's the latest thing. It's just a very confusing and an odd thing. And what's worst of all, of course, is that the doctors don't understand it either. And at the moment, they can try and help you with your symptoms, but they don't understand the underlying physiology, which is why it's so important that money be raised for research, even more that's being done now, and so they can actually figure it out.
I can really tell you're struggling for breath there, Emma. Thank you very much indeed for agreeing to do this. We can see just how physically difficult it is for you, but it's very important, isn't it, to get this message out there, because people think, right, well, you've recovered, that's COVID gone. But this is a real threat to people, even healthy people like you were.
I was. I mean, for a woman of a certain age, I think I was. I mean, for example, I could do a plank for 6.5 minutes, which apparently is very good. So as soon as I felt slightly well enough to, I started working out again. And I think that's had something to do with why I got long COVID. It's just a theory, who knows? But the advice I give to anybody who contracts COVID infection is to rest way more than you think you need to. Just keep resting and look after yourself really, really well for much longer than you imagine you would need. And, that maybe have something to do with those of us who are getting long COVID, but nobody knows.
Yeah, rest. Well, what help are you getting? You mentioned, obviously, the doctors. Is there a community, though? There is a community has developed, and all kinds of discussions taking place right around the country, right around the world about long COVID.
Oh, definitely, and that's extremely helpful. But a lot of the long COVID patients in the UK have been waiting with great anticipation for the opening of the long COVID clinics that have been talked about a lot. But first of all, some of them haven't even opened yet. Secondly, some of them are calling themselves post-COVID, which, of course, to those of us who are in the middle of it all, it doesn't feel like it's post anything. And then also the problem with the clinics is that actually they're not this great place to go to where we're all going to get sorted out that we've been sort of waiting for, because they haven't got the funding, they haven't got the staff, they haven't got the timing to have a multidisciplinary team of consultants waiting to send us out for all these really expensive tests. So the clinics are more about rehab and physio, which rehab and physio are great, but they're not necessarily what we need. One of the strange things about COVID is that people are having tests like CAT scans and X-rays and blood tests, and then things aren't showing up, which makes the doctors a bit more dismissive of us than they might ordinarily be. But then certain doctors are giving very advanced tests to patients and discovering all sorts of problems with them, like, for example, microclots in the lungs that didn't show up on a normal CAT scan. Or on a blood test. So there's lots to learn. And until then, all of us have to sort of try and be patient, really. It's difficult.
Well, Emma, thank you very much indeed. We and your legions of fans wish you all the very best. Please get well soon.
Thank you. Thanks.
Emma Sams there.